But my name's Stephen Doughty. I'm the MP for Cardiff South and Penarth, and I'm also chair of the all-party group on HIV and AIDS. It's one of the longest-standing all-party groups in Parliament, and we're really, really proud to have such a distinguished group of colleagues from the Commons and the Lords of all parties, people with a huge range of experiences and expertise. And one of our longest-standing supporters, of course, is the fantastic Lord Fowler, our Lord Speaker. I just ask everybody to pop themselves on mute if that's okay. Somebody's not on mute. That's great. Thank you. I'm absolutely delighted that Lord Fowler has been able to join us today. Now, at the time of organising this discussion, we didn't know about his imminent retirement from the role of Lord Speaker, but also the fantastic announcement that he's made about his future plans and particularly his work on HIV and AIDS, and we will come to that in due course. But for those of you, I mean, he needs little introduction, but for those of you who are less familiar with Lord Fowler's history, he's obviously been our Lord Speaker since 2016. And had a distinguished career in various different respects, including as a journalist and other roles, also national service as well, before entering Parliament first as an MP for Nottingham South, 1970 to 74, and then Sutton Coldfield from 1974 to 2001. He was Minister of State and then Secretary of State for Transport under Margaret Thatcher, pushing through, for example, the laws that made wearing seatbelts compulsory, another thing we have to thank him for. And most critically, in relation to our discussion today, from 1981 to 87, he served as Secretary of State for Health and Social Services, in which time he headed the department's response to the HIV/AIDS epidemic in those very early days in the UK, and of course oversaw the implementation of the groundbreaking Don't Die of Ignorance campaign. He later served as Secretary of State for Employment and as chairman of the Conservative Party, and later, of course, was granted a life peerage. And has held a number of distinguished roles in that role, and of course, most recently, as I said, as Lord Speaker. Lord Fowler, Norman, if it's okay, if I call you, has been a long-standing friend of the all-party group and has been very supportive of our work over the last few years. This is the last actually in a series of events that we've done, particularly around the groundbreaking Channel 4 series, It's a Sin, which very much reflects those early days of the epidemic in the UK, the discrimination, the tragedy that was faced by so many people who were living with and tragically dying with HIV/AIDS at the time. And a real delight today as well that we're joined by a range of organisations from across the HIV/AIDS sector. I think we've got representatives on the call from Terence Higgins Trust, National AIDS Trust, Fast Track Cities Cardiff, George House Trust, NAS, Prepster, many others, as well as colleagues from the Commons and the Lords. And I've just noticed good friend Steve Brine, former Public Health Minister, just joining the call, who of course was one of the members of the HIV Commission. And Steve and I actually had the pleasure of hosting Russell T Davies and some of the cast of It's a Sin the other day in another discussion. But I think what's been really critical about this period is that it's brought the issues of HIV/AIDS back to public attention, not least because of the current very difficult pandemic that we're living through, but also because of the huge challenges that remain at home and abroad, even though we've, of course, seen huge progress. So I'm going to talk for a bit with Lord Fowler, and then we'll open it up for questions. So if you do want to ask a question, pop your hand up in the chat, and we'll come to you when we get to the Q&A. But firstly, Lord Fowler, welcome. Thank you so much for joining us today. And tell us, when did you first become aware of HIV? Can you tell us a little bit about those first few days or weeks when you first heard about this new disease, this unexplained virus that was affecting not only this country, but many other countries?
I guess it was about 1984, 85 that I really kind of got to know about it. And it was really in 85 that it became clear that we were running into a crisis. And it was a crisis which was extraordinarily difficult for any health minister to deal with, because we had no cure, there was no vaccine, no medicine that we could give. And so we had to decide, what to do. And the obvious thing to do, and probably the only thing to do at that particular point, was to warn people who were not affected, not infected, about the dangers of acquiring HIV, and that is what we did. But that, of course, also brought with it its own controversy. I mean, we had people who said that, well, first of all, they said basically, you shouldn't do anything about it at all. People should be left to their own fate. The notorious comment from the Chief Constable of Manchester that people with AIDS were simply swirling around in a human cesspit of their own making, a quote of which he should have been immediately sacked, but wasn't. There were others who said people should be effectively segregated away from the rest of the general public. And I suppose the most general argument against what we were trying to do, I was trying to do, was the so-called moral argument, which was put very, very graphically by the chief rabbi, who said the campaign breeds a false sense of security, not to mention false values. It encourages promiscuity by advertising. It introduces many children, decent young people, to ideas of sex outside marriage entirely unknown to them. And his advice was, he's left me a long aid memoir on this, his advice was at the end, say plainly, AIDS is the consequence of marital infidelity, premarital adventures, sexual deviation, and social irresponsibility, putting pleasure before duty and discipline. So that was that wasn't altogether untypical. I mean, it sounds extraordinary now, but it wasn't untypical of the kind of views that were coming forward. And it solidified my view that the only way that one could deal with this was to deal with it as a public health issue, which we did, and a public health issue which did not discriminate in any way between one person and another. And that is basically what we tried to do. So we then went into the great campaign, well, a big campaign that we mounted at the time, the Don't Die of Ignorance campaign. Again, everything is criticised in this area. Not unlike, I suppose, what's happening with COVID at the moment, but rather more, I think, in our area. And whatever you did, you had a certain constituency who were always going to say, no, you shouldn't be doing that. But what was interesting, at my last point, what was interesting about it is at the end of the day, we did a follow-up survey on the reaction of the public. And over 90% of the public said we were right to run the kind of campaign that we had run. And I think that says quite a lot about the common sense of the British public, as long as you put the facts to them.
No, absolutely. And the fact that, as you say, you made it a public health issue rather than all those other things that people were trying to bring into it, I think was absolutely critical. What were some of the attitudes amongst colleagues in the Commons and indeed in the Lords? What were people saying to you as a Secretary of State, both publicly and privately? Was it similar to that tone from the advice that you received from the Chief Rabbi, or was it different? Were they supportive?
It rather depended on what colleagues you were talking about. In the main, I remember we had the first debate on AIDS. I can't remember what date it was, but that was very supportive. And that's still my memory of the House of Commons, that it was very supportive in what we were seeking to do. That's not to say everybody was very supportive. And of course, the Prime Minister at the time did not have quite the same view about the subject as I did. I mean, she had a rather curious view, frankly. Her view was that we were telling people things about which they knew not, young people. And the whole implication was that, everyone would race out there, although we were arguing for them not to actually indulge in risky sex, they would. Well, there's absolutely no evidence for that whatsoever. And of course, it didn't happen in that way. But I think there was a bit of the chief rabbi in her reaction. And I think her suggestion at one stage that for advertising, we should follow the VD precedents of putting notices in doctors' surgeries and public lavatories, I think might have been okay in 1945, but wasn't going to be much good in 1986, 87. So we didn't do that. And we had, for those days, a very high-profile campaign using television, radio, and every media. And incidentally, not the kind of campaign which we've had this time, with lots of money being spent on it. In the main, I had to get the money, well, not in the main, entirely out of my own, out of the budget of my department. And I remember one of the Treasury ministers who came to one of our meetings when we were going to do a drop round of leaflets to every household, saying yes, he wasn't prepared. He was quite prepared to see it go ahead, provided that it did not mean any more money from the Treasury, and that tended to be their attitude. But I would say this, perhaps I should just say this. My opposite number was Michael Meacher on the Labour Party, and he couldn't have been more helpful, actually. And I remember we managed to get Michael agreed for me to do a ministerial broadcast, or for a ministerial broadcast to take place. It actually got vetoed by the Prime Minister, but I tell you, as far as the Labour Party were concerned, it could go ahead, and it gives you some idea. I think in the Commons itself, I don't know what the attitude was in the Lords. I suspect it was pretty similar. It was quite supportive, in fact, of what we were doing.
No, that's really good to hear. And I mean, the campaign, the public information campaign, clearly did cut through. I mean, I actually remember, I think the first time I ever read anything about HIV/AIDS was actually my dad was a youth worker in Cardiff. I had been a youth worker in Cardiff at that time and was involved in various youth organisations. And they actually used to produce a kind of a health and well-being guide for young people, and it had a whole section in it on HIV/AIDS. And I remember reading that actually as probably around 1987 or so. So clearly cut through into lots of other media, which is fantastic. What was the reaction? I mean, obviously that campaign, I remember seeing it on the television. We all remember seeing it, and if we were around in the 80s. How did the campaign actually come about, and to use that particularly hard-hitting imagery, which has stuck in the public mind for many years since? And some people say it's even influenced some of the approach to the COVID public messaging, and maybe say a little bit about that. How did the campaign come about?
It certainly did influence sexual disease generally, because at the end of the day, HIV came down, and so did sexual disease generally as a result. I mean, I think that how we planned it was that we had to, and this came across, I think, in It's a Sin. We had somehow to get everyone's attention to what we were doing. And I remember the first advert we put out was a very worthy newspaper advertisement, but I don't think that it influenced too many people. Apart from anything else, you have to read for quite a long time before you got really the messages. And you really did have to do it in a way that caught people's attention, but without it being inaccurate. Mm-hmm. So I remember I had a lovely man, Donald Atchison, who was my chief medical officer, saying, you really cannot say anyone can get it, as if it was simply contracted in a kind of casual way, because that wasn't true. So every advertisement went past Donald to make sure that it was accurate. But we had some very good newspaper, very good advertising people helping us, who came up with some, I think, some rather good slogans. Sometimes they went a bit far, and sometimes, and it's perfectly true that I and Tony Newton went through virtually every advert before it was done. I remember there was one which suddenly you had this great, well, one of those Wild West trains which had those great hooters. And you had the sound of this great hooter going forward, and it certainly woke everybody up, and I'm sure kind of would have spilt tea all over Britain, but it had absolutely nothing whatsoever to do with HIV/AIDS, and that, I'm afraid, got knocked out, but most of it didn't. And "Don't Die of Ignorance" was exactly the campaign line that we should have had and kept to.
And you mentioned It's a Sin. I mean, having watched it now, Lord Fowler, like what's been your reaction to seeing that period of history depicted so vividly, including, of course, those adverts, but also some of the tragedy and discrimination that went on? What's your reaction been personally to the series?
I think it was a pretty accurate description of what was taking place at the time. I wouldn't in any way wish to say anything, but I think that it was accurate, and that is, I think, one of the reasons why a generation who never knew anything about this have been so moved by it. I think it was an extraordinarily good film. I think if I was to add one thing to that, I think that there is a slight danger that we look at it as a period piece from the 1980s, and all that has gone away. And much of it has gone away in this country. But if you look overseas, all the things that they are portraying in that film are actually taking place, not only in Africa, but in Russia and in Eastern Europe and all kinds of countries. It's all taking place there. You've got families throwing out their children, not being prepared to face the disease. After all, you've got 60, 70 countries who are still making homosexuality a criminal offence. So it is extremely good about the 1980s, but the lesson of it is that we should be doing very much the same kind of things now, and not think that the whole thing has come to rest. I do remember sitting next to someone who I won't name, but it was a household name in the House of Lords, and saying, and he said to me, well, no one dies from AIDS anymore. Well, depends what you mean by no one, but just happens that 350 million people have died from AIDS since the inception, since the pandemic began. So I don't need to tell this group, there is absolutely zero reason for complacency in this area. Indeed, quite the opposite. And my fear is that with cuts in government spending, not just here but elsewhere, and the difficulties now of sometimes raising money voluntarily, unless we're careful, the progress we've made might start to go back a bit. That's my fear, and I think we should take note of that.
Absolutely, and that's certainly the warning from bodies like the UN Global Fund that does so much to tackle HIV and TB and malaria and other neglected tropical diseases. I mean, there are huge global health challenges, and you rightly say as well how this is interacted with wider criminalisation, with attitudes towards the LGBT plus community, towards sex workers, towards injecting drug users. You know, there's a whole series of things here that are bound up in this. I mean, just on that point, I mean, to what extent do you think that people's reactions were and still are in some ways tied up with what maybe wider prejudices around, for example, the LGBT plus community?
And the more I think of it and the more I go along, I think that this is really very much at the heart of it all, and that unless we can successfully counter that kind of prejudice, then we're going to only make limited progress, Well, that must be the case, because even now, we have these 70 countries making it a criminal offence, but it's not just those. I mean, we all know in this country, but we all know even more in countries overseas where the prejudice is alive and big, and it just stands in the way of policy. It stands in the way of medical treatment. It stands in the way of testing, for example. I mean, who's going to go forward for a test if you know that it's homosexuality is actually illegal? So it is. I think it is the big issue, and one actually that parliamentarians can do most about, because frankly, we can try to influence governments, and sometimes you can do better than other times, but the thing you can do is that you can argue against this kind of prejudice and make it considered unacceptable by as wide a group of people around the country and around the world as we possibly can.
Absolutely. And last night, Lord Fallow, I'm not sure if you're aware, but we had a very cross-party supported debate on the issue of conversion therapy. Many of us across all parties want to see a ban brought in on that and the terrible harm that it does to people from the LGBT plus community. And there has, of course, however, been, huge progress. And, I was delighted a couple of years ago in one of the events we held in Parliament to have Festus Magai, former president of Botswana, and Joachim Chissano, former president of Mozambique, and both speaking very candidly, frankly, and supportively about the LGBT plus community, about sex workers, about injecting drug users, things you could never have imagined a senior leader, certainly from that generation, having said just even a few years ago. So I think there is remarkable progress. Did you ever believe we would be at the point where testing would be so available that we'd have treatments like PrEP, that the medical evidence would show that U equals U, undetectable equals untransmissible, that actually if you are on treatment and if you have the virus suppressed, that you cannot pass it on? Did you ever imagine back in those days that we could be in this place and having made so much progress?
I'm not sure that I did, but I think it's very difficult in the eye of a crisis that you actually think forward that long. And I agree with you entirely that we have made remarkable progress. But we have still got a hell of a long way to go. And sometimes, I mean, Uganda used to be rather good, but it isn't very good at the moment. I mean, it goes up and it goes down, and that is one of the problems here. I think we have made one of the things I think I'm most proud of. Well, Yes, I'm most proud of, is the progress we made on injecting drugs. Because when we came to injecting drugs, we had an enormous bite back from Scotland, where they had the biggest problem. I never quite understood why that was the case. But of course, people said, you're condoning crime. And we again took the public health view that the public health came first to that. But if you go to Russia today, that's still the view in Russia. I mean, they're not into methadone at all. They're into cold turkey and all that to actually deal with people who use drugs. So everywhere you look, there are still so many problems, so many issues. But overall, you must be right, and you are right, that we have made remarkable progress, thanks to these wonderful organizations like the United Nations, like the Global Fund, and like them all, and the voluntary organizations. We've got a NAT, THT, all those voluntary organizations in this country. I'm president of Mildmay Hospital, which has struggled on and on I mean, I was being pressed when I was minister to close it all down in about 1982. Well, it's still there, but I think we're entering another period in which we will be under some pressure.
No, absolutely. Well, maybe that brings me to my last question before we open it up, which is that you've spoken of the huge challenges that remain both here and abroad, and obviously, despite that, we've seen obviously progress, but there's still so much to be done, particularly with regard to issues like testing. And we've been campaigning around that in Testing Week this last month, and the All Party Groups Commission. We're actually doing 2 inquiries this year, one on testing, following up from the HIV Commission, but also we're doing one on the issues particularly affecting the BAME communities, and the particular discrimination and inequalities that exist in their access to treatment and testing. Tell us about your plans for the future, Lord Fowler. I mean, it was I was obviously quite shocked that you were stepping down as Lord Speaker, and very sad, but absolutely delighted to see what you said about, this is the start of a new career, continuing your campaigning on HIV/AIDS. So tell us, what does the future have in store?
Well, they're a bit uncertain at the moment. My diagnosis is that we're at a rather critical stage in policy as far as HIV and AIDS is concerned, in that the financial pressures are great now and are not likely to reduce very much. AIDS has never been top of the pops when it comes to raising money, as I'm sure 1 or 2 people here would confirm. You have to work quite hard to do it. And that applies not just to individuals, but it obviously applies to governments as well. And so keeping governments up to the mark, trying to encourage people to contribute. I mean, all that is, I think, important. I mean, the only thing I would say about the future, and I don't leave this job until the end of next month, but all I would say about that is that I am determined to try to do something on a more international basis than I've done up to now, because I think we remain, you know better than me, we remain with some very big problems in this country, but my golly, when I go to countries in Africa, it's nothing like the problems that they have there, and if I can help there, I will try to do so. So it's a matter of finding the right outlet, really, as far as I'm concerned, but hopefully with an international dimension.
Well, I'm sure you'll have people clamouring and knocking on the door, Lord Fowler. So, and we, of course, will be absolutely delighted to have you more involved as an all-party group as well. And actually, we're part of a global network of parliamentarians now called the Unite Network, which actually links parliamentarians in, I think, about 40 or 50 different legislatures now around the world, to make progress on these issues in each of their contexts. I'm going to open the floor up now for questions, and if people want to pop. Click on the raise hand function, which you can find at the top of your Teams screen. It will pop up on my screen, and we can go through those. So I'm just going to wait for the hands to go up. So I'm sure that some of you will have questions, and I can see one straight away from I can see one firstly from James Cole. So James, if you want to unmute yourself and pop your camera on so we can see you, we'll take a first question from you.
Great. Can you hear me, Stephen?
Yes.
Brilliant. Thank you so much for taking my question and for your time this afternoon, Lord Fowler. As Stephen was saying, delighted to have you back in the fold as a leading HIV campaigner, and also great to hear that you're interested in doing more work in international response, and really looking forward to forming a stronger partnership between yourself and Stop AIDS moving forwards. My question is more related to the parallels we're seeing now between HIV and our response to COVID. So as you know from your time in government and working in HIV response for decades now, it took us a long time to see HIV treatment access reaching low and middle income countries, whilst ARVs were widely accessible in middle income countries and high income countries too. And unfortunately, right now we're seeing a similar vaccine apartheid play out right now when it comes to access to COVID-19 vaccines. Some recent projections say it might take until 2024 for some low-income countries to have widespread immunization. And time again, we're seeing pricing barriers come into the fold as well. And a lot of this is due to intellectual property rights and being a hindrance to expanding vaccine production and to bring down prices as well. So I'd be interested to know from your time in government and working in HIV, what learning should we take from the HIV response to inform how we combat COVID-19 globally and in the UK?
Thanks, James.
Well, I don't think there's any neat answer to that. I mean, I think that the one essential is my successor in Simon Caulfield has been going on about it quite rightly too, and that is that the aid programs from various countries must be retained and must be maintained as well. But obviously, you put your finger on one of the real problems, whereas, I mean, unless there is, I'm never sure that the motivation for providing some of the drugs is there if you're speaking from a poor country with not a great budget to spend. So we somehow have got to actually face that problem anew, I think. Curiously, it may be the case that with the present COVID crisis, that it's easier to do, because remember, HIV has been a rather step-by-step progress. The remarkable thing about COVID has been we've come from zero to something that you can inject within 12 months. Well, we still haven't got a vaccine as far as HIV is concerned, and that's after 30, 40 years. So people can actually see it in a much clearer way than they perhaps could with us. It's also, I have to say, the case that people see their own interest affected probably more than they do as far as HIV is concerned. But I mean, we just have got to keep battling away in the same way as we've done before, I think. And there are various schemes now. I mean, I was trying to publicise one at the weekend, whereby, you know, those people who have 2 injections should make a contribution for the 3rd one, which can then go overseas. I mean, there are a lot of things that can be done there, but it requires a lot of resources. And, you know, frankly, the last thing to do is to cut back those resources just at this moment.
Well, I would certainly, I'm sure you'll find lots of agreement with you on that, Lord Fowler. And yeah, I mean, and as you say, your successor in Sutton Coldfield, who actually at one point was an opponent of mine, I certainly worked with very closely on issues around international health and development. And, you know, he's been a very, very strong voice on the Conservative benches and continued to be so. So a long tradition from Sutton, which is fantastic. I'm going to go to Lisa next. I think it is Lisa Power. Lisa.
Yes, thank you very much. Lord Fowler, what do you know now that you wish you'd known when you first heard about this strange virus that was starting to creep up? And what advice do you wish somebody had given you when it all happened?
Well, I don't think I can fault the advice I was given. I was given a lot of advice by people like you. And so, but I was also given a lot of good advice, particularly by the people in the public health section of the health department. I mean, people, you know, like Don Latterson, for example. So the advice, I don't in any way, I think was as good as you could make it. But that doesn't mean to say our knowledge was as good as you could make it. I mean, obviously what one would have preferred is a greater knowledge much earlier on, and then it wouldn't have taken so long. That's really what one wants with all these kinds of issues. But as you know, the HIV virus is quite a complicated one. I was on an international committee in New York. They'd been looking at it for 30 years, 20, 25 years, and they're still looking at it, and we still haven't made any progress. What I really don't know, it's an intriguing question, is if we put more resources, if we put the kind of resources that we've put into looking at COVID, into HIV and finding a vaccine there, would we be making more progress? Again, I don't know the answer to that. I mean, everyone told me at the time that it was just an extraordinarily complicated, fast-moving virus, and I'm not a scientist, and I suppose I believe them. But I mean, what I would have liked then, which I didn't have, was the kind of knowledge and the kind of response to that knowledge that we have now. But I think, you know, it's just, I mean, it's so good on COVID that we do seem to have the knowledge. We do seem to have the ability to be able to combat it in a way that, as you well remember, we just weren't able to do in the 1980s and much of the 1990s, and you know, going ahead on that.
Thank you.
I mean, interesting on the question of vaccine, one of the crucial things actually UKAID has been supporting is IAVI, the International Vaccines Initiative, and actually a lot of brilliant work of that going on in the UK itself. And actually some of their work, they were telling us the other day, has been able to translate across to work on COVID vaccines. So yeah. It's why these initiatives are so crucial. I've got Alison Thewlis, one of our SNP colleagues in the Commons, next, who had a question in the chat.
Hi, thank you very much. My question was around the issue that we have in Glasgow just now about bloodborne virus transmission through injecting, and just wondered if you had any thoughts you could share about the effectiveness of a supervised injecting facility and whether that would help this group, which is very much being left out and left behind by many of the public health interventions. They're a very difficult group to reach, or easy to ignore if you prefer it that way. And at the moment, the only service being, the only supervised injecting service being done in Glasgow at the moment is by a guy who bought himself an ambulance and is doing it on the street. We've got a heroin assisted treatment programme, but it's very small at the moment, and the way that the law stands, it would be very difficult for the local government to go ahead and do anything on that with the Misuse of Drugs Act the way that it is.
Yeah, well, I mean, the ambulance idea is, in principle, is right in the sense that one must have the facilities for the treatment to actually take place. And in the old days, in Amsterdam, there was a taxi that went round in the same way. And that also did a certain amount of good. People, I suspect, don't like the idea of having drug users coming to a clinic next to them. That certainly is the case with a number of pharmacists who aren't that keen on their pharmacies being used in that way. There's certainly one well-known chain. I mean, I think it's just got to be tackled. There's no other way of doing it, and somehow you've got to have the leadership to do that. I mean, it's not going to be automatically popular. and one sees that. But it must be possible to site clinics in a way which allows people to be treated properly without causing concern and trouble to their neighbours. And you know, I'm rather sorry to hear that from Scotland, because I mean, it has been one of the real breakthroughs in this area that you can actually do it. But of course, if you can't actually, if you can't have the facilities to transmit, then you're in all kinds of problems. So I mean, you know, all power to your elbow, but it does need leadership at the local level.
Yeah, I think there is that desire at a local level to do things. It's the Misuse of Drugs Act that is getting in the way of progress on that.
Well, if that's the case, I didn't know that, but if that is the case, then I think we should look at the personally.
Yeah.
Thanks very much. Thanks very much, Alison. I've got one of our vice chairs of the all-party group, Baroness Sue Masham, next. Sue.
Norman, do you remember in 84, 85, when we started the all-party group on HIV, you came as Secretary of State to talk to us. And I remember asking you for new money for HIV. You won't remember that, but it's quite difficult when you're a minister and when you're somebody small asking for more money. But actually, do you remember the doctors at the very beginning, Dr. Pinching for one, and they actually led the way to a better attitude for patients with HIV. And you know, that again is leadership. And I just wondered if we have these dedicated doctors as we had in those days, because they really did make a difference. And they made a difference to a lot of different disabilities.
Yeah, I think we do. I think we do. I mean, I think in Brighton, for example, where you've got practices which very much and groups which very much specialise in this area, and I think that I'm not always as generous to the medical profession as this, but I think that in this area they have done actually really rather well, and they have taken the lead, and they've knocked some of the prejudice out of it. So yes, I think they do it. They are there. They are working at this moment.
What has made it very difficult is Corona, because that's overshadowed so many things, and so many doctors have to do telephone consultations. So diagnosis is so important. So it is difficult. And looking at Glasgow and drugs, you know, COVID has covered so many things. And the other things now, with your help, when you lead your speakership, which has been excellent. To tell everybody, Norman's been an excellent speaker. But we're delighted you're coming now to help in these other matters.
Thank you, Sue. You must come to all my meetings.
Lord Fellow, we've got a question now from, I think if he's still with us, Simon Lamb. Simon.
Hi, can you hear me okay?
Yeah, hi, Simon.
Hi, Lord Fowler.
Hi.
Thanks very much for your talk. I just put it in the conversation in there. It's really important that you made that point of the fact that, you know, it's a sin, it's risky because it could be seen as a period piece, and I'm kind of guilty for that because, you know, I'm quite a young millennial, and it seems quite distant and detached from us. And I mean, part of my naivete is that I look at you as a conservative, you know, Secretary of State at time of Section 28, and, you know, certain pieces of legislation that wouldn't have been seen as favourable towards LGBT people. So I just wanted to ask, what is it that has made you quite clearly courageous and vocal in your support for LGBTQ rights and also for HIV awareness, you know, as a Conservative MP and a Lord, well, former Lord? Thank you.
Well, I don't claim that I've got all my attitudes right over the years, but the longer that I've been working in this area, the more obvious it is. And, one keeps on learning new things. I remember in India learning more about transgender people than I had learnt up to that moment. They are a totally persecuted group there. And I think my basic motivation was originally, still is to some extent, is that it was so bloody unfair what people were saying and were doing and were in their prejudice against gay people and all LGBT people. And I never understood it really. I didn't understand why people were taking this view, and it was something that was worth fighting against, and that's really how I've kind of tried to base my life from then onwards. But I don't claim that I've always got everything right. I haven't.
Thanks for that candid answer, Norman. I've got two last questions, and I think we'll be out of time. So I've got one of our other vice chairs, Lloyd Russell-Moyle. Lloyd.
Thank you, Lord Fowler, and we are, of course, patrons of Beaver together. Yeah. So that's hopefully we'll be able to see even more of you now in those forums. But one of the things that I was interested in what you were talking about earlier on was about how messages needed to be targeted not just to everyone, but sometimes you needed to target them to specific people. If you just say everyone's at risk, it doesn't cut through. And one of the, we've got this inquiry in the APPG about HIV in BAME, Black, Asian, minority ethnic communities. And we've seen also, I guess, with COVID, that hesitancy of particularly BAME communities in taking up the vaccine. Is there something around how, I don't know, I'm just posing this as kind of open question. Is there something about how the establishment, how people like you and I communicate that just doesn't reach whole sections of our population, and that we maybe need to rethink about it, not only in public health, but in all political kind of messaging, because there seems to be that real divide that sometimes is along ethnicity and cultural lines.
I think you put your finger on a real point. I just had a severe lecture from my 16-year-old granddaughter on this subject, saying that it is on transgender, saying that it's all very well, in effect saying you old guys in Parliament taking this view, but you should listen to the young people on this. Getting the point of view of young people over is, again, quite a difficult thing to do. And it's also difficult in much wider perspective than that. All I would say is I think lots of people are trying to face that issue, and we have been not very successful in a number of areas. We have been much more successful in others, but it's just something which we continue, as with the whole area, we need to continue bashing away at and trying to find some recipe which is rather better.
Thank you. We've got one last question, which is from a good colleague and friend, Ray Collins, Lord Collins of Highbury.
Thank you very much. And I thought I'd better get in quickly and place on my record my gratitude to the Lord Speaker for his excellent chairmanship of the House of Lords, and also his ability to grant all urgent questions, which
thank you very much.
I shall try and submit a couple before you leave office. My question actually is just to sort of acknowledge the work you've been doing on stigma, which remains a real big issue, particularly as Lloyd has said, in certain communities. As you know, I'm a patron of Positive East, and what we've been trying to do there is work directly with faith groups that historically have been quite hostile. I mean, is there something you think we could be doing better in terms of reaching out to those communities, particularly faith groups? Should we ask other faith groups to sort of join in a more collaborative approach here?
I think it's a very good question, not one I have a kind of particularly neat answer for. And I'm sure you're right about stigma and about prejudice and all that. And I kind of slightly persuaded by the events of the last 24 hours in this television interview in the United States to say, well, I hear what someone said in a conversation inside the palace, but there are some really big issues out here which actually dwarf all that and knock it into a cocked hat. But on stigma itself, we've still got quite a long way to go, and I think you're right. I'm not sure about which groups you go to. I mean, I don't think that any of the that many of the churches have been very courageous on this point. And I know it's difficult, for example, for the Church of England, I suspect, because first of all, you've got you've got the churches here, but then you've got churches in Africa, and the home population there is probably living, or can be living, under laws which make homosexuality illegal and which are supported by the local population. But I mean, I suppose that the answer is that we should try to encourage. Well, we have more access to bishops than most people in the House of Lords, and to encourage them to somehow rather quickly evolve a rather better message on this than we're succeeding in doing at the moment. And that would begin to have a persuasive effect. But I don't think, I mean, if I may be totally frank, I don't think the churches have been very good on this up to now. And it's a vast pity. And it's not because, there aren't some extremely good people in those churches. There are. But it needs a degree of leadership, which hasn't been there at the moment. That's a rather disjointed reply, but but you're right in where you point at one of the real problems in this whole area. And I'll try and give you a P&Q on the subject there before I leave.
Well, that was a good last question to get in there, Ray. So, no, and I think highlighting one of the big challenges, and I mentioned the debate we had last night, and as a person of faith myself, I mean, there are some huge challenges within faith communities on all of these issues. So, but I just wanted to end really by just thanking Lord Fowler for spending an absolutely fascinating hour with us this afternoon. He's still a very busy man, and I'm sure will continue to be a very busy man going forward. And it's been fantastic to see so many colleagues from across the Commons, the Lords, from the HIV/AIDS sector, from staff joining us this afternoon. It's been absolutely fantastic, and we hope to be able to share a recording or an audio recording of this for others afterwards, to be able to catch up on if they've had other parliamentary business. But Norman, honestly, I mean, I think there is a huge admiration and respect for the work that you did, not only at that crucial time in the 1980s, but also your continued commitment to these issues over many decades, your support for us as a group. And we're all absolutely delighted that you'll hopefully have more time to spend with us. And I certainly look forward to working with you, particularly on some of those international issues, because, as you say, those is where some of the biggest challenges lie. It was a sad fact that in 2019, 1.7 million people got newly infected by it with HIV, and 700,000 people lost their lives to what is a treatable disease, and one that we can live with and live long, happy, healthy lives with. So I think it's been absolutely fascinating. Really, really thank you for joining us this afternoon, and I look forward to working with you in the months and years ahead.